Patient Preparation by Milagros Lopez Ramirez.
My name is Milagros Lopez Ramirez. I am one of the child life specialists for the pre-operative area. And what a child life specialist is, we are professionals who are specialized in child development and recreational therapists. And we hold a bachelor's degree or master's degree. And we focus on preparation for children who are coming to the hospital to have procedure with a strong focus on play. According to the child age and according to the procedure, we explain to them in a simple way what we do. And we, for the younger kids, we prepare and support parents so that way they know what to expect and they can feel more comfortable. And we try to also help them answering their questions so that way their concerns are addressed. For all the younger kids, we just give them some material to interact, to be more familiarized with them. And for children who are 2.5, 3 years and up, we can actually prepare them and kind of walk them through step by step what to expect. I use a picture book and I have a teddy bear with me, so that way it's easier for children to understand what is happening and what they are going to go through. And we address their questions and concerns. For children who have a special need, we learn from parents what works for them. And sometimes it's pictures, and we are very concrete, sometimes 2 or 3 pictures, and sometimes some words. And we can work also with the school teachers in order to prepare them. You are going to see a preparation that I did and the way that he was walked through step by step what was going to be happening today.
Preoperative phase teaching.
Good morning, I'm Milagros, I'm child life specialist.
Hi, nice to meet you.
And we are here to help children and family prior surgery. We provide psychological and emotional support for kids before procedures, and I would like to explain what is going to be happening today. All right? I have a teddy bear, because sometimes there are children younger than you. They don't understand what we are doing here in the hospital and why they need to change into hospital clothes, and that is the reason I have a teddy bear to help me to explain the kids, what things we do here in the hospital. I have a picture book here that helps me to explain you what is going to be happening today, okay? And if you have any question, I'm going to be more than happy to try to answer your question or look for the answers, all right? And I have some medical equipment that I'm going to show you, so that way you know what to expect, and when the doctors or the nurses use it, you will not be afraid. All right? So if you have any questions, you can ask at any time, okay? So every person that is going to be with Brandon, in the surgical room today, every time that we come to the bedside, we are going to be checking for the same information just to make sure it's the right patient and we are doing the right procedure. And this tells us that you have some allergies. So you came to the hospital and you came to the 3rd floor and registered, and your parents were there. And you remember that as soon as one of the nurses was ready for you, she brought you here, okay, and give you a checkup. It's like when we learn about your body. We weighed you on the scale today. Did we do that? Okay, we weighed you on the scale. And also, did we listen to your heart? And also, we use the blood pressure, okay? We took your blood pressure and we put that around here. And it gets a little bit tight, but it won't bother you. Did that bother you? No. And it goes a little bit tight. We practice with that. And usually you can do that. You want to try to do that, and I will hold it here. So it gets tight, 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 and we let it go. Okay? Good job. So the other part we do is we make sure how much fresh air you have in your blood. And to do that, we actually use the pulse oximeter. The way we do it is, through this red light, okay? And it's really soft. It will not bother you, okay? And when we turn the computer on, okay, that is how it reads, okay? So let's see if you can try. Ready? So how that feels?
Doesn't feel better.
Okay. So do you think you will be afraid using this when the nurses need to give you a checkup? Okay. Thank you. So I just wanted to make sure when the nurses are using it and the doctors are using it, you are no concerned, okay? Because before we do anything, we are going to tell you. So when you are here at the hospital, no surprises at all, okay? We are here to take good care of you. That is the reason everyone is here for, to take good care of you, and we are happy to answer any questions, okay? So do you have any questions so far? No? Okay. So as soon as one of the nurses, gave you the checkup, they gave you some hospital clothes. So that is the reason I have that here too. My friend Coco is wearing hospital clothes, so we can teach kids that in the hospital we need to wear these special hospital clothes. That way we don't bring germs. When we walk on the street, we can bring germs from outside, and we want to keep the hospital very clean for you and all the kids and patients that come here. That is the reason we need to wear the hospital clothes, okay? Any questions so far?
Operative phase teaching.
Before everyone's going into the operating room, everyone need to wear blue gowns, okay? So here you will see everyone wear a hat. How do I look with my hat? Good. There's my silly hat. And also you will see that people need to wear a mask, okay? Again, what do you think we need to wear this hat and mask? Just to protect, exactly, just to protect you from germs, okay? We want to keep the operating room very clean and safe for you, so everyone, all the nurses and the doctor wear hats and masks.
Post-operative phase teaching.
So once you are asleep and they finish, the surgery, we bring you into the waking up room. And again, in the waking up room, doctors and nurses will be taking good care of you, all right? She have her special item from home right there. And initially, she feels, you are going to feel a little bit tired. In the morning when you need to get up to go to school, but even though you have slept so many hours, you're still a little bit tired. So you may feel like that when you get up, but it is okay to go back and take a nap. Once you are more alert, more awake, okay, if you are not feeling tired, the nurses in the waking up room, recovery room, okay, are going to give you some popsicles, okay, water, Italian ices. So they are going to make sure you get some of those, okay, once you are alert, once you are more awake, okay? And after that, they will be telling you, mommy and daddy, when it's time for you to go home. Once you are feeling better, and and they think, okay, now Brandon is ready to go home. So sometimes you can have a wheelchair drive, or you can, if you feel like now you are big, so I don't think mommy or daddy are going to be carrying you. Maybe you're going to have a ride in a wheelchair, okay? And after that, the nurses will be, from the recovery room, will be calling at home just to make sure how you are doing and talking with mommy and daddy. If you have any question, they know they can call the hospital at any time. All right, so it's going to be a short visit, okay? So any questions for me? No, do you think everything is explained? All right, good. So I will be checking in the recovery room how things went, and if things went the way I explained it today. All right? So this is pretty much, the preparation I do for this age group, and when you spoke to the doctors and the nurses, they are going, if you have any questions, they're happy to answer the questions. And, these are pretty much in general the step-by-steps, what to expect today. And you go to the family waiting room. Okay. In the family waiting room, we have the surgical liaison nurses. Those are the nurses that will keep you updated during the time that Brandon is in the operating room. And usually if the surgical time is longer than 90 minutes, hour and a half. After hour and a half, every half an hour, they will be calling the operating room to give you an update. And as soon as Brandon is back to the recovery room, they will bring you back there. And also, as soon as the doctors finish the surgery, they go to the family waiting room to meet with you and let you know how things went. Okay. So the whole time, there is a person that keeps you updated, and you can come to us and we can try to answer questions you have.
Great.
Okay, thank you so much. You did a very good job. I'm so proud of you. Good job. Thank you for watching the video that I was preparing a patient prior his surgery, and hopefully it will be helpful to you to prepare other kids and family and support them. Thank you.
Please help us improve the content by providing us with some feedback.